COVID-19 cases in Karnataka has risen to 500, with 26 new COVID-19 cases reported today. Now, the total number of cases in Karnataka has risen to 500. In the last 24 hours, 26 new COVID-19 cases have been reported. Several cases being reported in Bengaluru as well. Among the cases that have come to light in Bengaluru, the majority of cases are from Hongasandra, that right now remains a containment zone. A migrant had contracted COVID-19, after which for 3 days he visited one hospital after the other, but it was only after 3 days that he went to the Rajiv Gandhi Institute of Test Diseases, a designated hospital for COVID-19, where he tested positive. Until then, he had come in contact with several people, hundreds of people in fact, and they have all now been tested. Over 100 people have been identified as his primary contacts. So the cases continue to be on the rise in Bengaluru, but most of the cases have come to light from Hongasandra. In the last 24 hours, 26 new COVID-19 cases have been reported across Karnataka. So 13 people have tested positive for COVID-19 in Bengaluru, and 5 people have been infected by patient number 419. This is the patient we were talking about in Hongasandra, the first case that came to light. The health department officials still do not know where he contracted COVID-19 from. He had symptoms of COVID-19, so he went to the hospital and then he tested positive. Now, the health department officials are trying to find out the source of how patient number 419 contracted coronavirus. My colleague Suraj joins us live from the newsroom with more details on this. Well, Suraj, no let up in the total number of cases being reported. Now, 26 new COVID-19 cases have been reported. Take us through the details of where these cases have come in from.
Well, absolutely, Pratibha. Mainly with today's medical bulletin, from what we have analyzed, from what we have seen, most of the cases have been reported either from Belagavi or from Bengaluru itself. Now, in Bengaluru, we have seen that close to 13 cases have been reported, and most of them either it will be from Padrayanpura or it will be from Hongasandra, and especially from Hongasandra, we have seen that the primary contacts of patient number 419, they have shown the symptoms and they have tested positive for the virus. On the other hand, there are others who are primary contacts of another person who had contracted the virus from patient number 419. So probably in that particular area, we have been seeing how the number of cases have been rising. Now the main question being raised is whether or not there are possibilities that these people have interacted with people from the outside world, that is, from outside their own area. If that is the case, that will become a cause of concern for the BBMP staff, because they'll have to start tracing out whom they have come in contact with and how many primary and secondary contacts are there, not just for patient number 419, but now they'll have to start looking at the other patients. That is, up until afternoon, there were close to 26 cases which were reported from Hongasandra. Now, if we see now the cases have increased to 33. So 33 cases just from Hongasandra is a cause of concern at this point in time. Now, here the cases being reported. This was from morning. Patient number 475 who had visited the BBMP containment zone, 34-year-old male who is currently quarantined at a hospital. On the other hand, patient number 476 is where we'll have to look at. Patient number 476 is a contact of patient number 419. So this is a primary contact where they have contracted and they have shown symptoms of COVID-19. Even patient number 477 as well is a primary contact of patient number 419 and has been quarantined, 21-year-old male. Even patient number 478 is from Hongasandra itself. That is contact of patient number 419. It's a 17-year-old male. Patient number 479 as well, 19-year-old female, who's also a primary contact of the patient from Hongasandra. Now, how the patient had contracted this virus is yet to be known. The source is yet to be known, but the cases are on the rise. Now in Mandya as well, Mandya mostly it is from the Malvalli region, that is patient number 480 also is contact of patient number 419, but patient number 481 is from Mandya. Now it is mostly from the Malvalli region where most number of cases have been reported, especially 15 to 16 cases have been reported just from the Malvalli region. So another contact of patient number 78 who had tested positive. Now they have been quarantined. Patient number 482 is from Belagavi, secondary contact of patient number 128. So even in Belagavi, for that matter, several cases are being reported. In Belagavi, we could say that this could be the super spreader in Belagavi. Patient number 128 could be the super spreader, because even patient number 483 is from Belagavi itself, secondary contact of patient number 128. Even patient number 484, 80-year-old female, there's no cause of concern because age-related ailments will also be there. So secondary contact of patient number 128 is being reported. Even patient number 485 is from Belagavi. Secondary contact of patient number 128 has been quarantined at a designated hospital. Patient number 486 is also from Belagavi, 42-year-old female who is a secondary contact of patient number 128, who had travelled all the way to Tablighi Jamaat, so that is a cause of concern. Even patient number 487 is reported from Belagavi, who is a secondary contact of patient number 128, who had travelled to Tablighi Jamaat congregation. Now the new numbers which are coming in is patient number 488 had a travel history to Hindupur and Anantapur, and all of the contacts of patient number 488 have also been quarantined at this point in time. Even police personnel who had arrested patient number 488 for selling beef, now they have also been quarantined, and their samples have also been sent. On the other hand, from Bantwal in Dakshina Kannada, where one of the death was also reported, so patient number 489, 33-year-old female is a contact of patient number 409 and has been quarantined at the designated hospital. Now patient number 490 again is interesting, because the next 4 cases we will be speaking about will be the secondary contacts of patient number 419 again. So earlier we had seen how many of the primary contacts were known. Now the secondary contacts have come to light of the 419, the super spreader case. The 6-year-old male, this is an infant which we are speaking about. The infant has contracted virus, patient number 491. 6-year-old male has contracted COVID-19, a secondary contact of patient 419. On the other hand, patient number 492 as well is a 90-year-old male. Even this is a cause of concern, because age-related ailments could also add on to these cases. So as a secondary contact of patient number 419 has been quarantined at a designated hospital in Bengaluru. Patient number 493 is a 27-year-old female from Bengaluru itself. So it is a secondary contact of patient number 419, the super spreader which we are speaking about, Hongsandra. Patient number 494 again from Belagavi, where we are speaking about the super spreader in Belagavi. Patient number 128, again the secondary contact of patient number 128 who had travelled to Tablighi Jamaat congregation. So 20-year-old male had come in contact with the patient here. On the other hand, patient number 495, if we have to take a look, 8-year-old male from Belagavi. Hirebagewadi, here secondary contact of patient number 128 has been admitted at a designated hospital and is currently receiving treatment. Patient number 496, 30-year-old female reported from Belagavi, and a secondary contact of patient number 128. So all of these are the secondary contacts which you are seeing today. All of them which have been reported from Belagavi in particular, most of them are the cases, secondary contacts which we are speaking about. Now patient number 497 is from Nanjangud. Patient number 382 who had come in contact with patient number 52. So now a primary contact of patient number 382 will be patient number 497, also from Nanjangud. So probably the number of cases related to Nanjangud is decreasing, but Nonetheless, the point that the district authorities are trying to identify the cases is something which needs to be kept in mind. Patient number 498, also again from Bengaluru Urban itself, contact of patient number 465. Now, not to forget, 465 was from the containment zone. So now they have identified these cases here. Patient number 499, 27-year-old male from Bengaluru Urban, that is contact of patient number 465 again. And has been quarantined and designated hospital. And patient number 500, where 66-year-old female has been reported, contact of patient number 465 again. So here 500 mark Karnataka has reached at this point in time. Many of them, even the senior citizens who have shown the symptoms, who have tested positive for COVID-19, they have to be a close watch on them, because many of the numbers which we are seeing today, we have seen many senior citizens also testing positive. We have seen 90-year-old cases as well coming to light. That is a cause of concern, and probably the health workers as well as the doctors will have to keep a close watch on them. Now, with respect to the patient contact history, patient number 419, we have been seeing how the cases have been rising every day. Patient number 476, 477, 478 and 479, 480 and even patient 490, 491, 492, 493, all of them have shown the symptoms as of today, Pratibha.
Okay, all right, Suraj. So these are the details of all the fresh cases that have been reported today. But, if we look at the silver lining, if any, it is that the health department officials continue to trace all those who have come in contact with these patients. But, all of these cases have come in from the same area, which means that, of course, it is bad news that in the areas that have been already designated as red zones, the cases are on the rise. But the good part of it is that in the other areas, in the green zones, it has not been reported. Even now in Karnataka, only in the 20 districts where over the past few days cases have been reported, there the cases might be on the rise, but in the other districts it has still not spread. And in Bengaluru as well, apart from these containment zones, no new fresh cases have come to light from many of the other areas.
Well, absolutely, it is a silver lining also. So we have to consider this as a silver lining, because somewhere, yes, the number of cases are on the rise, but at the same time it will be only restricted to those containment zones or the hotspots or the epicenters where they have already been identified. But we cannot rule out the fact that there are possibilities, if at all they have come in contact with others from outside of their ward or outside world or from other wards as well, that will become a problem. So that is something which the healthcare workers will have to start identifying. When we spoke about the source of patient number 419, probably this is what we are speaking about, because there are possibilities when he had gone to Kim's hospital, or when he had gone to Victoria hospital, or when he had gone to RGICD, or the clinic which he had gone close by to his residence, he could have contracted the virus anywhere. He had shown symptoms, yes, but at the same time he could have met someone there, and probably he got the virus from any one of them. So now the main task for the BBMP officials, the main task for the healthcare workers is to identify the source of the virus. Identification or contact tracing, probably they are doing it at their best capacity, but identification of the source is something which we have to see, and how well will they be able to identify the source is the big question. Because even in Mysuru, we have seen Nanjangud case, they are still trying to identify how patient number 52 even contracted the virus. What was his source of this particular virus? Well, where had he visited, and whether or not he had actually spoken to a few others who could have had the virus before, and he had contracted from them, and then his co-workers got the virus. So all of this is something which the healthcare workers as well as the BBMP staff will have to start looking at, and probably the source is should be looked into. The source should be identified at this point in time, Pratibha.
Right. Many thanks, Suraj, for joining us with all those details. So now the total number of cases in Karnataka has reached 500. Several fresh new cases have been reported. 26 new COVID-19 cases have been reported in Karnataka. In Bengaluru, 13 new cases have come to light, and 5 of these have been infected by patient number 419. 6 of them have been infected by COVID-19 in Belagavi. One case each being reported from Mandya, Chikkaballapura as well as Dakshina Kannada. Meanwhile, in Belagavi, taking a look at patient 128 has been the source of contracting COVID-19 for several patients in the fresh cases that have come to light today. Patient 482, 483 as well as 484 and 485, 86 and 87 have all been infected by the very same patient.